Hello everyone, welcome to a Nursing Mind, and today we are going to start a series AIIMS NORCET 2021 question paper. So in this series we are going to discuss the questions and answer of AIIMS NORCET 2021, and this is a part 1. So let's start. The first question is maximum time of hand hygiene. Your options are option A 90 second, option B 20 to 30 second, option C 1 minute, and option D that is 2 minutes. So in this question we asked about the maximum time that required for during hand hygiene. So uh, this is the normal hand hygiene, so it required time at least 20 to 30 seconds as per CDC. So our B option is right option. Question number 2. Suitable position for rectal examination is option A is prone position, option B is lithotomy position, option C is dorsal recurrent position, and option D is Sims position. So in this question we ask about the suitable position for the rectal examination. So rectal examination is a diagnostic method for inspecting the disorder of lower GI tract. If the patient has prostatic disorder and gastrointestinal bleed, if the patient have a gastrointestinal bleed, and examination of Bowman for the vaginal wall prolapse, or colonoscopy or proctoscopy. For these conditions, for these examinations, we required rectal examination, and for the rectal examination, we use Sims position, that is option D. So Sims position is used for the rectal examination. So this is the example of Sims position where the rectum is clearly visualized and we can perform the rectal examination. So the next question is the minimum and maximum score of GCS are. GCS is Glasgow Coma Scale. So option number A is 8 to 9, option number B 8 to 12, option number C 12 to 13, and option number D that is 3 to 15. So what is the right answer of this question? So its right answer is 3 to 15 is a right answer, because the minimum number in the Glasgow Coma Scale is 3 and the maximum score is 15. Uh, in this image, this is a Glasgow Coma Scale, uh, and in this there is a 3 parameter. First is eye opening response, second one is verbal response, and third one is motor response. So there is a 3 parameters, so minimum marks is 3 for the unresponsive patient. If the patient is unresponsive or in a deep coma, so patient we got 3 marks. If the patient full responding patient, so patient got 15 marks. So in the eye opening there is a 4 marks, verbal response there is a 5 marks, and in motor response there is a 6 marks. So total is 15. So minimum score is 3 and the maximum score is 15. Next question is hospital acquired infection are also known as. Option A is nosocomial infection, option B is primary infection, option C iatrogenic infection, and option D that is idiopathic infection. So its right option is option number A, that is nosocomial infection. So in the nosocomial infection, the person get the infection from the hospital after 48 hours of the admission. So uh, its right answer is nosocomial infection. And the primary infection is an infection where the person get exposed first time to the pathogenic infection, that is called primary infection, where there is no innate immunity about a particular infection. And C option is a iatrogenic infection. So iatrogenic infection, where the medical it occur after the medical or surgical management in the hospital, whether the patient is hospitalized or not after the medical and surgical uh, operation. And option D is idiopathic infection. So idiopathic infection is an infection where the infection occur with a no cause, that is a unknown cause. So its right option is option number A, that is nosocomial infection. Next question is side effect of chloramphenicol is option A dizziness, option B headache, option C bone marrow suppression, and option D immunity suppression. So the chloramphenicol it causes low dependent reversible bone marrow suppression. So its right option is option number C, that is bone marrow suppression.
So next question is, which of this is not the principle of health education? So the options are option A comprehension, option B credibility, option C interest, and option D, that is unknown to know. So in this question we ask about in those options which one is not the principle of health education. So the principles of health educations are simple, easy, understandable, comprehensive, credibility, and interest. So these five are the principle of health education. So comprehension, credibility, interest are the principle of health education, and option D is the right option of this question because unknown to known is not the principle of health education. Next question is needle gauze preferred with the blood transfusion is. So the option A is 16 gauze, option B 18 gauze, option C 20 gauze, and option D is 20 gauze. So in this question we asked about the needle gauze that is preferred or that is a standardized gauge needle for the blood transfusion. So its right answer is 18 gauge. 18 gauge is the right answer, and it is a green color cannula that required for the blood transfusion. 16 gauge needle is a required for the emergency blood transfusion, and 20 gauge needle is required for the adult patients. It is the most common use cannula for the adult patient, and 22 gauge needle is mostly used for the children.
Next question is neonates compression ventilation ratio. So options are option A 1 is to 1, option B 1 is to 2, option C 3 is to 1, option D 1 is to 4. So its right answer is option number C, that is 3 is to 1, because in neonates the chest compression with ventilation ratio is 3 is to 1, means 3 compression and 1 breathing, and the compression should be 120 per minute to achieve approximately 90 compression and 30 breaths per minute. So its right option is option C, that is 3 is to 1.
The next question is identify the given figure. So uh, we have a given image and we have to identify what is this image. So your options are option A, Homan's retractor, Fairview retractor, option C, Dwayne's retractor, and option D, Davier's retractor. So this is the Davier's retractor. So option D is the right option.
Next question is percentage of burned perineum is. So in this question we ask about the burned perineum. According to rule of 9 we have to give the answer. So option A 1%, option B 9%, option C 18%, option D 4.5%. So according to rule of 9, our arm, each arm calculated at 9%, our anterior trunk calculated as 18%, posterior trunk is as well as 18%, Head and neck calculated as a 9%, and legs, each leg calculated as a 18%, and our genitalia or perineum is calculated only 1%. So its right answer is option A, that is 1%. Thank you very much for your listening. If you like my video, please hit the like button and subscribe my channel. So thank you once again. We will meet in next video. Thanks.